Today I'll be explaining how to assess a chest tube. First, we're going to check that the doctor's orders are what the patient needs and is good for this patient. We're going to gather our supplies, which at this point in time we don't have those supplies. That's why we're just explaining it. And we are going to go to the patient's room, do hand hygiene, introduce ourselves, get two patient identifiers, provide privacy, and raise the bed to a nice working height. Assess the patient's pain level, and then assess the tube to see if it's flowing correctly, if it's straight, if it's angled, if it hasn't been pulled from the site, that the patient is not laying on it, and that it's draining the way it's supposed to and functioning properly. Everything is working fine. Then at this point in time, we are going to position the patient on their side, explain what we're going to do. Hi, my name is Eddie. I'll be doing changing the dressing on your chest tube. And are you familiar with the procedure? The patient is familiar with the procedure, so I'm going to have him lay on his side. I'm going to put on clean gloves and a mask, and I'm going to put a chuck right beneath the patient. I will remove the dressings, old dressings. Be gentle with in doing that, and then I will assess the site for any signs of infection, swelling, redness, tenderness, discharge as well. I will also assess the dressing to see what's on the dressing, if there's any discharge, any gunk on there, if there's any smell that would be indicative of an infection, what the color looks like. Then once that's done, then we're going to go ahead and clean with the site with chlorhexidine, and we're also going to clean the tube with a second tube of chlorhexidine. Then I am going to remove my gloves, set up my sterile field, put on sterile gloves, and use my all the supplies that I have. First thing we're going to do is we're going to put the petrolatum gauze around the insertion site, around the tube. Then we're going to get two sets of split gauze, and they're going to be the opposite to each other, so they're going to interlock around the tube. After that, we're going to put a dressing, 4x4 dressing, to flatten the surface, and then the whole dressing will be covered with microfoam tape. So it usually takes about 2 strips of tape. We are going to assess the patient at this point in time. We're going to assess the patient, see if where his pain level is, where how he's tolerating the procedure, and then we are going to remove all the trash, remove our gloves, our masks, and we'll turn the patient, once the bed is clean, put everything in a bio bag. Then we're going to chart the site. We're going to put the patient back down to a comfortable, safe and comfortable position. Give him the call light, ask him if he has any questions, and if he needs anything, you can always use the call light for us to come and help him with his needs. We're going to chart the site, what we saw, the assessment we did, the dressing we did, the type of dressing the dressing we did, and the drainage, what we saw, then how the patient tolerated the procedure. And that's what we'll be charting. And so For that is those would be the steps that we do as far as a chest tube dressing and assessment.